Hello, and welcome to the Non-Operative Spine Care course. My name is Carlo Ammendolia, and I'll be one of your instructors. By way of introduction, I'm a chiropractor and a clinical scientist and an assistant professor in the Department of Surgery at the University of Toronto, and I'm also the director of the Spine Clinic and the Spinal Stenosis Program at Mount Sinai Hospital. The other instructor will be Josh Plenner, and he's also a chiropractor working at our spine clinic. He's also an associate scientist at Mount Sinai Hospital, and he is a PhD candidate in clinical epidemiology at the University of Toronto. So, why a non-operative spine course for spine surgeons and trainees? Well, it's inevitable that the topic of non-operative care will come up with your patients. Regardless of whether your decision is to have surgery with this patient or not, patients will often ask you about alternatives to spine surgery. So it's important that you have an informed discussion with your patient, and that is what this course is all about, to provide you with the knowledge about what is available from a non-operative perspective, but more importantly, what is the evidence supporting these interventions. In this way, you could have not only an informed discussion with your patient, but also this will help you make shared evidence-based decisions around non-operative care with your patients. So those are the main objectives of this particular course. Number one is to provide you again with the various options that are available for various spine conditions from a non-operative perspective. Also looking at the best available evidence that is supporting these various non-operative options. We also have a lesson looking at the psychosocial and the contextual factors in spine care, because we know that these factors can impact outcomes both from a surgical perspective as well as a non-operative perspective. In Module 2 of the course, this will be a hands-on, in-person session where we will be demonstrating for you the various approaches that we've talked about in Module 1, and also provide you with the rationale on why are we taking these approaches and what is the evidence and rationale around these various approaches. And then we'll also have some interaction with you as well. Being in person, we can have exchange of ideas. And I'm sure you might have many questions around the various operative, non-operative approaches that we're taking. And finally, we'll have in Module 3 case studies that we'll be presenting during the dinner, and hopefully the case studies will highlight many of the things that we've discussed both in the didactic but also during the in-person session. The various conditions we'll be talking about include spinal stenosis, lumbar radiculopathy, low back pain, neck pain, including cervical radiculopathy and cervical myelopathy. And also we'll look at, again, the psychosocial and contextual factors in lesson number 5. We will not be talking about oncology in this particular course. In terms of disclosures, I am the founder of Spine Mobility Research and Resource Center. This is a non-for-profit organization. The aim of this particular organization is to develop online courses for both practitioners and the public, with all proceeds going back to support our research. So let's get started.